whatever you start at, it is, so either it's $1 trillion or it's $2.5 trillion, depending upon where you start. And without getting into how it's paid for, is it paid for, therefore it's not deficit?
I will be glad to concede to the senator from Montana that the attempts of the Democrats to pay for their $2.5 trillion bill are Medicare cuts, tax increases, and additions to the deficit by not including the physician's reimbursement, which is an essential part of any 10-year health care plan. There may be other problems with. Those are the three things that I know about. That
one more question on my time.
It's fine with me. Yeah.
Is it true that there are no cuts in guaranteed beneficiary payments? There are no cuts, none whatsoever in this legislation of guaranteed benefits.
I would say no to that, Mr. President, because the director of the Congressional Budget Office made it clear that there would be specific cuts in benefits for those who have Medicare Advantage, which is about 1 out of 5 seniors.
Is it true that those provisions are not guaranteed provisions? I'm talking about guaranteed benefits that seniors expect to get when they go to the doctor. You get a fee for service, the expected benefits they expect to get under ordinary Medicare, not benefits that a private plan, in addition, might pay.
Well, Mr. President, in response to the senator, it is clear that there are $465 million in cuts in Medicare. The president, the senator from Montana, the senator from Connecticut, all of us have agreed that that's half of how the bill's, or a big part of how the bill is supposedly paid for. And it's specific enough to say that $135 billion comes from hospitals, $120 billion from Medicare Advantage, which 11 million seniors have, nearly $15 billion from nursing homes, $40 billion from home health agencies, $8 billion from hospices. That's the Baucus bill that came from the Finance Committee, and this bill's not that much different. And the director of the Congressional Budget Office testified that provisions like that would result in specific cuts to benefits for Medicare Advantage. He said that fully half of the benefits currently provided to seniors under Medicare Advantage would disappear, which the changes would reduce the extra benefits such as dental, vision, hearing coverage, and that would be made available to beneficiaries.
Well, there's one more question. Does the Senator agree that this legislation will extend the solvency of the Medicare Trust Fund for 5 years, and failure to pass this would mean that the insolvency of the Medicare Trust Fund would not be extended for 5 years?
Mr. President, I would wholeheartedly disagree with that assertion. The Medicare trustees have said that between 2015 and 2017, Medicare will be approaching insolvency, and they've asked that we take urgent action. And the urgent action recommended by the Democratic majority is that we take $465 billion out of the Medicare program over 10 years and spend it on a new entitlement. Now, it's hard for me to understand how that can make Medicare more solvent when you take money out of grandma's Medicare and spend it on someone else.
Respond to another question. Isn't it, shall we say, Enron accounting, when you have a proposal that you, as soon as the bill becomes law, you begin to raise taxes and cut benefits, and then you wait 4 years before any of the benefits are then extended to the beneficiaries? That, on its face, is a remarkable piece of legislation. My experience, which has only been 20-some years, that we haven't passed legislation and says we're going to collect taxes on it for 4 years, and then we are going to give you whatever benefits that may accrue from this legislation. And again, there has been no time in history, I would ask my colleague, there's been no time in history where we have taken money from already a failing system to create a new entitlement program.
Which colleague are you asking?
Pardon?
Which colleague are you asking?
I was speaking to, I believe the senator from Tennessee has the floor.
Yes, he does.
But then obviously I was addressing the person who has the floor, which I'm sure that the senator from Montana should understand by now.
Well, I would say to the senator from Arizona that he is exactly right. Or another way to describe it, the senator from Kansas said it was like writing a big check on an overdrawn bank account to buy a big new car. I mean, maybe another way, if I could respond to the senator from Arizona, and I would ask consent that Republican senators in our time be allowed to engage in a colloquy.
May I ask the senator another question? Mr. President, may I ask the senator another question? With respect to the question
I'd like to finish responding to Senator McCain, if I may.
All right,
first.
fine. Then I have a question on the same subject.
Right. I hope the parliamentarian is keeping track of.
I hope he is too. This is a bit difficult.
I'm enjoying the question. I thank the senator from Montana for his question. One of the things that was, in fact, I've been getting, a great compliment's been paid, if I may say, to the senator from Arizona. It's rare that a mere United States senator can have something he said actually begin to break through the fog. And Dana Milbank, a very perceptive Washington Post columnist, wrote a column today talking about it being all about grandma and wondering why we never mention grandpa. And maybe Mr. Milbank hasn't seen the movie The Big Fat Greek Wedding, where the man said, "I'm the head of the house," and the woman said, "and I'm the neck, because I can turn the head any way I want." So we're talking about grandma because she can help persuade grandpa. But the fact of the matter is, if we take $465 million or billion over 10 years out of Medicare, grandma and grandpa and those who are younger who are looking forward to Medicare are going to be affected. And I wonder if I may say to the senator from Arizona, and then I see the senator from Oklahoma and Nebraska here, it wasn't long ago, in response to your question, in fact, it was 2005, when our Democratic colleagues when we sought to restrain the growth of Medicare by $10 billion over 5 years. And this is what they said. Now, remember, they're restraining the growth of Medicare by $465 billion and spending on a new program, and Republicans were at the time trying to save $10 billion over 5 years. An immoral document, said Senator Reid. Senator Dodd, the distinguished senator from Connecticut, funding for Medicare would be cut. Senator Rockefeller, a moral disaster of monumental proportion. Senator Boxer, in the same way, compared it to Katrina. Senator Kerry, we're passing the cost on to our seniors. Senator Levin, we're going to be hurt by this bill. Irresponsible and cruel, said Senator Cole. Senator Reid, Senator Hillary Clinton. Mr. President, that was for $10 billion of restraining the growth of Medicare to spend it on the existing program, yet this proposal by the Democrats would take $465 billion and spend it on a new program.
Isn't that true? And isn't it true now that the senator from Montana is on the floor that he wants to enter in here, maybe he could respond to his comments 14 years ago when we weren't trying to create a new entitlement program, which is the object of the senator's bill. We were just trying to enact some savings in the Medicare system. And so what did Senator Baca say? And above all, we must not use Medicare as a piggy bank. You know, what are we using $483 billion in cuts in Medicare for? And then the senator from Montana said, that is disgraceful. Perhaps some changes lie ahead, but if they do, they should be made for the single purpose of keeping Medicare services for senior citizens and people with disabilities. Now, isn't it true now that we are taking $483 billion out of a system that is failing, that the Medicare trustees say is going to go bankrupt? So the senator from Montana, 14 years ago at least, said seniors could easily be forced to give up their doctor as doctors begin to refuse Medicare patients and hospitals, especially rural hospitals, close. Isn't that the effect of taking $483 billion in cuts in Medicare? Then the senator from Montana went on to say, equivalent to blowing up the house and erecting a puff tent where it used to be. Well, if that's blowing up a puff tent, I'd say this is a hydrogen bomb, I would say to the senator from Montana. And finally, staggering. And now, of course, under the senator from Montana's bill, the leadership